Where do they want to go? Right here?
I think we're going to do this station first, just to get it out of the way.
First. I don't know yet.
You know what, Dr. Clark? Let's do our surgeons first.
Which ones?
Let's do this one first.
Okay.
Yeah.
I got it. This is the audio, and they're live right now.
Live?
Yes.
I'm going to let her drive. She said.
We want this.
Who wants to hold it? That station is live, so if you want to put it near him.
Okay.
Oh, yeah,
They're
that's
live.
Dr. Clark.
Yeah, so do I want to put it to him?
Yeah, go ask him, but go.
Excuse me, Andy. Gotta get through. Dr. Park? Can I just to you for
yeah.
live stream? We, what do you say?
아무나 편한 데 해주세요.
안 해도 될 것 같아.
안 해도 될 것 같아요.
뭐죠?
No, maybe no need to. Yeah, Mike. Why?
라이브, 여기는 라이브 스트리머 있어. 여기는 비디오 있어.
오케이. Thank you. Okay, thank you.
Thank you.
Can you check it? It's okay. Okay. But Mike I believe Mike is more better for Dr. Kim.
Dr. Kim?
Yeah, because he can speak very fluently.
Okay. Dr. Kim is on the other side, right?
Yeah.
No, it's just to confirm the level. Dr. Kim? Dr. Kim, can I put a mic on? Can I put a mic on?
First, you can palpate bone gently insert and some feeling of bone. You can feel like this. You can feel some bones. Like that. And injecting the needle arm. That's it. First, and then check the CI. You don't have CI.
Okay, we're gonna bring one. Okay. Yeah, he wants what station you at?
One.
Oh, cool. You're in the cool station. Okay. 저 같이 파트너예요, Dr. Fisher.
Oh, yeah.
Yeah.
Yeah, my friend.
Or are you bringing in extra?
I believe it. Yeah. As I told you, we can get the midline.
Are you coming in this way? Yeah. 이쪽으로 오는 게 좋겠죠?
네.
Yeah. Come this way, please. Little tight course here, huh? Driving CR.
Just only for level marking. Yeah, level marking size location.
Okay. I guess that's our no AP, right? AP.
이렇게 교수님 페지컬 미디얼하고 파세스 페지컬 어퍼 3부에서 스킨싱이 제일 좋잖아요.
Right.
그걸 대충 알기 위해서는
Yeah. So he, initially goes with the AP view to mark the medial wall of the pedicle. So.
You have to L4 whatever. Okay? So This region is located in the medial wall of pelican and the upper one third of pelican. Yes, here is the best place for skin disease. Here it is. From midline to the lateral. Skin disease for portal. This room is working portal. From here to here, about 2-6 centimeters. The skin is moved to more orderly, okay? I'm trying to gain more orderly and maybe sorry. Okay, shoot it. Okay, near, it's there. So maybe it's okay. That's it.
Okay.
Probably not.
Does this table go up? No, right? Okay. We may have to. Let me see if the foot. I can raise the table. There's actually hold on, I got it. Little wag. Better to move the mountain than. Okay, so he wants a little wag to parallel. Okay, let's take a shot. One third proximal of the pedicle.
괜찮대. 이제 인시즌 넣을 때 오케이.
Yeah. So he's saying that the needle right now is slightly proximal, so you kind of know that the lower proximal, so you make the incision slightly distal. So it should be, the incision should be occupying the proximal third of the pedicle. Yeah. Okay. You could pull it out. Yep. Knife, please. So he likes to make transverse incision. Yeah. But what he's saying is that, you know, for the beginners, it's better to do longitudinal incision because you're going to screw up most likely and you're going to have to convert. So if you start out, exactly. You know, so you start out doing transverse, you're screwing yourself. You can't convert, right? You're going to have a T incision. So that's why, but if you become expert, you're good at it, you're not going to convert, then you go transverse. The water comes out easily and the maneuverability is much better. So the master surgeons use transverse incision. Beginners should use up and down incision. Okay. 여기서 이렇게 할게요. 여기서. So we're gonna make a transverse incision because he's the master, and we're gonna make a little bit larger incision. So notice, right? I cut the fascia a lot. So I go right to the spinous process, right? And then just lean on the spinous process and cut the dorsal fascia all the way through. That's very important because that allows your movement.
Including fascia. Yeah, not muscle fiber는 자르면 안 좋잖아요.
Yeah.
fascia만 자르려고 노력하는.
So cut the fascia, but try not to cut the muscle fiber like I just did.
And 블루틱 가지고 원하는 스피너스 프로세스 만들 미드라인 스피너스 프로세스부터 보시죠. 미드라인부터 만져야지 바깥쪽 만지지 말고 스피너스 프로세스를 만지면서 마스를 세퍼레이션 하면서 약간 깊게 움직이면 인트라미널을 쉽게 만질 수 있어요.
Okay. So what he's saying is that when you go start dissecting the muscle, you first feel the spinous process. Spinous process is L4 in this case, right? L4. Because is L5 is way the heck down there, right? So L4, because it's right there, and then you start stripping the muscle of the spinous process. Don't go with the lamina first.
L4 plus and L5.
It's a blunt dissector. You could use the back of the knife too. Yes.
L4 스피로스 만지고 L5도 만지면서 인터스피로스 리가먼트를 만지셔요.
Okay, so what you do, you feel the spinous process of L4 and then L5 go distally, and then in between you're gonna feel that you feel that? You see that? That's the interspinous ligament. You actually kind of, so that's where you're stripping the muscle.
Yeah, more deeply moved, more deeply, and then you can finally interlaminar space.
Right.
Yeah.
So you go 4, 5.
4, 5, 4, 5.
Here's 5 spinous, and then you kind of come down. You strip.
여기 보면 이제 인트라미나 스페이스 만져져요. 보면 만져지는데 여기가 목수, 라미나가 만져지죠. 여기 L4 하네요.
Yeah, so you feel the lamina of 4. Here was spinous process. I fell onto the lamina, and then you fall into the interspinous area right there, soft area, interlaminar.
여기 폭발 인트라미나거든요. 이 각도 기억하나 봤어요. 이 각도.
And then you should remember that angle when you fall into it, like the bone, boom. I think maybe one of us should really feel it, you know. So you kind of get even though next session is supposed to be.
There's so many interlaminar space is the most important because you start interlaminar space.
I cannot overemphasize the importance of this step. This step is half of the surgery, right? This is the most important part. Because if you don't strip the muscle in the beginning, you're going to be there half hour to an hour, like, where the hell's my probe? Where the hell's my probe? You must remember that angle. I'm just literally word for word translating.
Come down. You can feel interlaminar. Okay? Come here. Yeah.
Light hand.
Finding interlaminar space. L5, L4, L4 그다음에 교수님 이제 이것도 챔버를 만드는 거죠.
Now you palpate it. You're creating a chamber by going back and forth, going more lateral, stripping the muscle off the lamina.
멀티피두스 마슬이 라면에 붙어 있는 게 아니고 거기에 패층이 있잖아요.
네.
떠 있는 거잖아요.
네.
그 물을 채워가 챔버를 만들거든요.
So multifidus, as you know, is not really attaching to the lamina. They're just sitting there. There's a plane. There's a fat plane that all we're trying to do is lift that muscle off and then fill it with water. Yeah. Why is it called sun space? I don't know.
Not correct.
Not correct.
Yeah.
It's part space.
No.
No, okay.
It's only space for bipolar surgery.
Okay.
Never. There's no only that son is a believer that the soul space. But
It's like meta space.
we need a working port, okay? And we need the endoscopy port. So usually the port is too close. This is too close. There are partings.
No good.
Only about 2 or 3 centimeter difference. If your patient is too big, the difference is wide. To scale of fighting. 내가 말씀드린 이 너무 가까우면서 교수님 파이팅이 일어나잖아요. 그래서 이제 뚱뚱한 사람이 좀 많이 벌어져야 돼요.
Yeah.
그래서 가까운 사람이 좀 적게 벌어지는데 이 정도면 위에 있는 인더스피로스 프로세스 있잖아요. 인트라미나 스페이스 이 정도도 괜찮아요.
So what he's saying is that, for skinny people, you don't have to be too far. Obviously, big people, you want to be farther. Last thing you want to do is too parallel, too close. Then the scope and the working channel is going to fight, and you're right. So you want to be looking at it, and you have room to play. So what he's saying is, in someone like this, basically, you could palpate the interspinous area above, and that should be where you can make the incision.
이거 한 20년 충분하고 무슨 넣으시죠?
Yeah. So we're gonna make the second incision.
왜냐면 이 우측 포트는 조그만.
Yeah. So for the camera, you don't have to make a big incision. We're gonna make a. 바로 갈까요? 여기. 이 정도?
아, 700
여기서부터. Okay. So we're gonna incise the skin 7mm, and then just cutting the fascia, right from the spinous process all the way, but not the muscle. I forgot all that stuff.
이거 들어가면서 스피노스 프로세스 만드세요.
So as you're putting that in, again, feel the spinous process of L4.
L4 스피노스 프로세스 and come down and 라미나를 만드시고.
And then, so you come down, you feel the lamina of 4.
This is like lamina here. And then kissing this foot.
And that's very important too. As you come down,
스피노스 만들고 조금만 들어가면 라미나 만드시죠.
Yeah.
라미나를 따라서 잘 내려가면서 빨리 만드세요.
So you feel the spinous process. It's kind of a little bit different because you're coming from a different angle. But you feel it, and then you feel the lamina, and then you feel the tip. That you could hear it. That's what you gotta be at. Otherwise, you're gonna be looking for this thing all the time. So here's my lamina above, boom, and then here's my tip.
제일 중요한 게 완전히 터널이 안 되고 챔버가 두 개가 되면 절대가 안 된다는 거죠.
So if you make
있는데 이 원이 그대로 있고 챔버가 두 개면 절대 팁을 볼 수가 없어요.
Right.
확실하게 팁을 완전히 터널이 해가지고 이렇게 해서 완전히 구멍을 뚫어요.
Right. So if you don't make the two channels connect, and you have a separate channel, and there's a membrane in between, even if it's small, you're not gonna see jack. You're not gonna get any water flow. You're not gonna. So it's imperative that you really hear the clang.
Well, even more than touching, you need to hear the metal.
Yeah. Because I mean, you're there. There's nothing in between. Oops.
여기 들어갈 때 스피노스 만들고
Camera's coming from the 3-4 space, and that's at 4-5. So you're above and below the 4 spinous process, essentially.
This is almost close to the level of the disc space. Yeah, like that portal entry is right here, whereas this one is much higher. Because when you're working, you're not only working in too much of angle. You're only working directly, above the pathology.
라미나 본 위에서 반드시 기반선에 절대로 안 됩니다. 반드시 볼이 있어요.
This is a very key point. Yeah. This step is like.
That allows the water to come through. And that's your whole.
And then you find your working tool. Otherwise, you don't see it. All you see is muscle. You're like, what the hell? Yeah. Because once you see the arthrocare, you start burning, and you can see the bone. Not for this part. I did do my case with the navigation, just to confirm where I was, if I was past midline or not. But this part you should be able to.
I feel like you can go too deep too, like in between the space and then cause trouble.
5'1", yes, but you really have to be up to 4'5". I mean, like 5'1", you gotta be careful.
Gotcha.
Yeah.
The right side hand is pretty similar to like dropping a tube, kind of palpating the drop,
Yeah. This is like similar to tubular cases where you're like feeling it. And I'll hold it for you. You got it?
And then 트루커.
draw car was.
내안 가져갔구나. 나 이거 모르는데. 저 사람이 어디 갔노?
Hey, william 선생님, 전 선생님, 혹시 우리 초카 있어요? 플라스틱?
플라스틱 없죠?
Yes.
Plastic choker? William?
Yeah.
Okay. William knows.
이거 어디가 들었냐고.
아, 이거 워킹.
말고 이거 워킹.
그럼 그냥 스콥 집어넣어. 예, 예.
바로 스콘을 넣는
예, 슈스 일치형이라서.
그럼 여기다 바로 넣으면 된다고요?
예. So on his workflow, he uses a shoulder draw car, has a bevel, so he actually uses it to like retract the tissues and orient, you know. But the other guys don't use it. Like Dr. Ha uses a very small incision, like watertight incision. He literally drives the scope in. Okay, there's a button there. Yeah,
What's the
그
pump?
테이블 높이
30 minimum, 30 to 50.
30.
Yeah.
암이 붙고. 아,
The table height has to be important.
눈물이 안 나오지. 이거 빼고 그러지. 오약해. 아, 이거 프레스 때 프레스도 30,
Yes.
30에서 50mm.
The pressure is 30 to 50 millimeters. You don't want to go too high, then it could raise your intracranial. Yeah, you could really stroke someone out. Right. So something's wrong with the pump because usually at 30, the water flow is much more robust than this.
이렇게 튜브를 딜라테이션 해야 되잖아요.
Yeah. So now you got to dilate the working portal.
또 서볼 넣고 그다음에 시레를
Right. So now you're gonna start dilating.
그다음에 인트라미널 스페이스 항상 기억을 해야죠. 이렇게 이 각도에 들이를 하잖아요. 인트라미널 이게 있다가 꼭 기억하셔야 됩니다.
So again, remember where the interlaminar space is, where the ligament and flabrum is, right? Because that's where you're gonna be working. So up here, I'm just feeling the lamina of 4, but this is where you gotta be. So the scope's gotta go hang out there, because that's where you're gonna find the spinal lamina line.
이때 이제 우리가 이걸 딱 기억을 하시고 드릴을 여기서 시작하고 계시면 들어갔으면 잡으시고 그다음에 이제 RF 있잖아요. RF.
Yeah. Is the RF one ready?
보시면 잡고 넣으시고 RF를 찾아야 되겠어요. 이거 빼고 또 여기에 아마 여기 얘들 쓰는 게 이거 같아요.
Yeah, yeah. So once we dilate, we put the
요게 수업이 된다고 하니까 이렇게 해가지고
yeah.
넣고
Okay, so let's make sure it's in there.
여기 나오고 예. 물이 잘 나오니까 이죠. 그다음에 찾아야 되는 거죠.
Woo, there's my bone, there's my trunk.
여기 카메라
I gotta focus.
예. 포커스를 안 맞춰봤는데 밑에 그 잡고 있을래요?
Yeah.
네, 그 잡고 제가 맞춰볼게요.
Oh, much better. Okay. So here's 교수님 조금 하시지.
이게 이렇게 카메라를 깊게 놓으면 라미나가 바로 보이잖아요.
Yeah. So you stick in the scope all the way in, then you see the lamina right away. You see that?
이거 트라이앵귤레이션이라고 하는데 제가 빼가지고 말씀드릴게요. 이게 혹시 카메라 팁 앞에 이 기구가 항상 앞쪽으로 와 있어요.
Yeah. Always make sure that your tool is in front of the camera.
카메라 like this, okay? 보통 이렇게 되거든요.
That's usually what happens to the beginners.
항상 잡는다고 그래요.
And they're like, what the heck is it? What the heck is it? Just make sure you always, yeah, you gotta find that. Yeah. So you gotta look at the triangulation and see where you are.
이게 수술의 실제 제일 처음 오는
That's the number one cause for failure.
두 번째 얘하고 너무 떨어져 있는 거예요. 이렇게.
Or the other cause is you're too far apart. You should be right at each other.
그러니까 이거 못 찾아가지고 이거 찾아야 수술이 되는데
Yeah.
못 찾아가 수술이 안 되는 거예요.
They can't find each other. So that's why they fail. That's why it was very important that you feel clang, clang, clang.
이렇게 되는 게 제일
And that's the most important part. That you got to be able to see that.
이렇게 해서 움직이면서 따라가는 수술하는 거예요.
And then you follow each other around.
애들이 항상 이렇게 움직여요. 그 다음에 드릴 오거나 스레시 오더라도 스레시 오더라도 스레시 여기 있어요. 오케이?
Yeah.
이렇게 스레시 보이고 수술할 수가 있는데 이렇게 되면 돼요.
Right. Right. So every instrument that you use, make sure it's right in front of your camera.
그래서 항상 이제 그게 제일 중요하다고 말씀드리고
Water. Water.
여기 잘 뽑자. 잠깐만요. 이거 잘 뽑을게요. 뽑으면 좀 좋다. 아, 이게 내가 쓰는 거 없으면 보시면 이렇게 해가지고 왼쪽 찾았잖아요. 앞쪽에 있어요. 이렇게.
Yeah.
보이나요?
Yeah.
그 다음에 이제 우리가 인터라미널 스페이스 찾아야 되거든요.
So now looking for interlaminar space.
이 앵글 보세요. 아까
Look at the angle. You see? You know where we remember where the angle was, right? Interlaminar space. Because my mistake is I'm always up higher because you figure you should be in the midline. You're not. Actually, you're down there. You're going straight down, and that's angling. So that's how I get lost.
아래 거.
So ablation is not.
아, 손을 아, 이거 이게 밑에가 거기가 위에가 거기.
So when you're like superficially, they usually do like 7, 8, 9 ablation, but the coag is always 1 or 2. But once you open the ligamentum flavum and whatnot, they bring it down to like 2, 3.
Right now, blade is on 9, and then later they bring it down.
Yeah. So he uses everything with foot pedal. So this one is not ready for foot pedal. That's why it's going to slow him down a little bit. So what he's doing is just cleaning the tissue between the spinous process up there, and then you'll see the lamina down there. Just you know, little stuff, fatty tissues, whatever.
가지고 패스 갈색치면 땡길 수가 있는데.
Yeah.
내가 들어가가지고 이게 없으니까. 그래서 요사이 끼우는 있을 건데 없어요. 아예 없어요.
Troc. Hey Andy, we don't have any trocars for Dr. Park. No. 없는데.
이렇게 해서 이제.
So this is the tricky part when you first start out, because you look little docile-oriented, all these things are in your face, you get like, what the? But you got to take your time and burn away all that tissue until you just see the bone. You'll get there. All of a sudden, you're like, oh. That's the interlaminar space he's pointing to right there, the little slow yellowish area. A little more to the 9 o'clock is the bone. Yeah. So he normally again uses a trocar to push the tissues out of the way, but because he doesn't have that, it's taking a little longer to get that visualized. 뭐야? Oh, the blade. Okay.
Watch your back.
Okay. Where's the drill ready? Is there a foot pedal for the drill? 어, 여기 있네. 아, 가만 있어봐. 이거?
Okay, I'll let you.
다른 게 좋은데 뭐가 좋은지 모르겠어요. 이게 안 들어오거든.
당기는.
아, 이거 좀 손을 하는 거가 있어? 아, 맞네.
발로도 안 되나? 발로도 될 텐데. What the heck is that? Whose is that? What else is turning? Oh, that controls for something else?
Well, 이거 drilling. This is going to foot.
이제 물을 빠야 되는 하는 거고.
예.
이게
Wait.
반대로 안 들어.
That's RF.
Oh, this is RF? No, it's not. That's the drill.
Okay.
But it's going someplace else. Where's the drill that's connected to this? Yeah, I hear it. Where is it?
Right there.
Oh, this. Oh,
그 오픈들이.
Striker pedal is. That's striker pedal.
yeah. Where's you have another pedal?
Yes. That
Oh, can you give us the other pedal?
Arthur's pedal.
Yeah, Arthur X pedal. Is it? He's looking.
I don't know that there is a pedal.
Shaver.
핸드 같은데. 스트라이크 페달 중에서
Yeah, there's no.
And
Can you get a pedal? Or switch the pedal?
스토프 티스를 갖다가 트렁크가 터치침에 써야 되는데 요거는 귀찮을 수 우리 교수님
예.
교수님을 시키라고 하셨죠?
예.
오케이 여기 있으면 이제 교수님 여기 씻고 보이죠?
Yeah.
그다음에 인트라미나를 찾아가지고 이거 맞으면 여기가 맞으면 인트라미나인데
So that's kind of we're at the spinal lamina junction there. What he's gonna do is use that to kind of clear out the tissue.
여기가 인트라미나 이게 스피너라미나
So that you see that little open space, 2 o'clock, 3 o'clock. That's the spinal lamina junction. So this is where he starts to drill, and you'll find the ligamentum flavum. The 12 o'clock is midline, 9 o'clock is proximal. Yeah. So when it's drilling, right, it seems very easy, like the bone's coming off. But when you actually try to do it, it doesn't come off. You don't realize how much force you gotta kind of put it.
So why do you use this drill and not the other drills that the other surgeon drills?
He mentioned it before because this one has its own suction, so you don't get the clouding, you don't get the snow effect. You might have noticed on Dr. Hu's video, every time you drill, he has to stop every 2 seconds because it gets filled with the bone. No, this drill. Yeah, whereas this one, he could do this.
So it's not because of aggressiveness of
No. Yeah. It doesn't cloud out the surgical field. You keep taking down the lamina.
속도가 스피드가 좀 올릴 수 있는데 이 스피드 좀 올려달라고 했어.
It's also in reverse.
Okay, go all the way.
And forward.
Sometimes he likes to go reverse.
여기 소프 춥다. 이 반대로 돌리면 어떻게 물어봐야 되는가?
So he wants to figure out how to change the rotation. 잠깐만요. Maybe two. Yeah.
You just click something and it changed it. Then you click it back. You want to go forward?
Forward 해보실래요?
Oh, that's awfully. There's four. Oh,
Okay.
아니 그게 reverse.
No, this is reverse.
Reverse, okay, thank you. Reverse, thank you.
Reverse is good.
반대쪽 갈 때 이제 리버스로 가려고 했거든요. 반대쪽 이 컨트롤 때는 반대쪽으로 리버스로 가고,
Yeah.
그다음 왼쪽으로 갈 때는 forward을 가고, 반대쪽 갈 때 백워드를 가고 되거든요.
So what he's saying is that when you're going the contralateral, it's safer to go reverse. When you're ipsilateral, it's safer to go forward because the way it bounces, when it hits the bone, when it bounces, when you're reverse, you always want to bounce to the safer side, which is distal. You don't want to bounce forward where there's detachment of the flabrum. Like the whole case, your flabrum is your friend, right? So you retain the flabrum. You retain the flabrum until the last moment because that's what's going to protect you. Forward.
아까 버튼 누르실 때요. 두 번 아니야 한 번 더요. 아니,
No.
다른 버튼이요.
한번 해보실래요? 요거.
예.
Aggressive. Okay, you're forward. You see how it bounces? Yeah. So the soft tissue you could get rid of with the drill, he says. Like, I use so many different drills. This one is good. It's just that I don't have the right drill. That the hood on mine it covers the whole damn thing. So I use this. So I just take it out or stop once in a while. So you see the lamina, you see the flabrum. Yeah, so you want to go, where's the 4x4? You want to go kind of like insert your burr on top of the flabrum, but underneath the bone. You kind of like, as you go, you're dissecting the tissue more. That's AGG. 한 번 더 누르세요. Forward. 한국분이.
한국분이에요.
한국 놈이 한국 여자 한국 돈 no.
그럼 요거를 지금 보호도 맞나요?
지금
Forward.
forward이에요.
그러면 여기서 이제 보시면 바깥쪽에 있는 라미나를 먼저 갈아야 안쪽이 보인다는 이야기가 중요하거든요.
So it's good to always start grinding out the superficial layer so you could see the deeper layer.
카메라가 하고 있어요.
Okay.
보온이 안을 가리잖아요.
Yeah. So if you if you take away the deeper first, then you start blocking the view. So it's important that you start from the superficial.
그리고 이제 이 라미나 플라우하고 보온 사이를 갈아줘야.
See, it's always good to take the bone, the edge of the lamina and the flabrum. So right now, as it's doing, you have no idea where the midline is, right?
Yeah.
No idea. That's why he was saying you go up until you see that detachment point. Then you know where your midline is.
Wow.
Then you could kind of say, okay, how far I gotta go lateral, how far I gotta go medial. And 지금 8,000. You want higher? Oh, that's the maximum. That's okay.
이렇게 해서 이제 갈아가지고 어떻게 스페이스 나오는 걸 찾아야 되겠죠.
So that's what he's looking for. He's looking for the detachment point, the midline.
Did you know that? Did you see the fat?
Because you see that little fat in the midline when we do Lamy. That's what he's looking for. Yeah. So take away the outer layer first, so you could see the deeper layer. But having done this, you could get very disoriented, and you think you're kind of midline. Sometimes you could be way the heck over on the other side, because our tendency is to go more that way because you don't want to break the parts. So I find myself not coming out lateral enough, and I actually find myself actually working on the other side, not realizing. And then you get the midline, like, oh shit, I'm on the other side. So he has leaning with his body. It's actually a lot of torque on that thing. That's why you don't want to take up the flabum, and you always want the sleeve just in case you plunge. There's a protection. So he's looking for that detachment. There we go. You see that? That's exactly. Now he's like, oh, I know where I am.
You know where we are. Here is the midline. So usually we can drill out about 그러니까 15mm 되잖아요. 여기서 이렇게 좀 다르고 이거 지키면서 하면 바시스 안 깨진다는 거죠.
Right. So now you have the reference point. You kind of know how much you got to come out before you break the parts, right?
이걸 미네랄을 먼저 찾아야만 우리가 바시 조인트를 약간 이렇게 세퍼레이션을 시키면 들어가게 되거든요.
Right. So before you drill further, what he does is he kind of separates the flabum of the bone so that the burr could kind of go in between. There's a space for the burr, and then burr out the bone.
여기 이라스가 프로세스잖아요. 여기를 아래 퍼가지고 여기를 좀.
So now you got to figure out, okay, RF. You got to figure out where is the bottom, right? Where is the lamina of 5? But there's always so much tissue on it, so it's hard to palpate even. Oh, the ablation is at 0 now. We got 지금 딱 0이에요. 0. 올려야 돼. Raise the ablation to 9. Right there. 잠깐만 꺼보세요. 지금 0 돼 있어. Okay. So now he's trying to expose the medial aspect of the facet joint, and that will follow you to the lamina of 5. 네? 최대한 maximize the power. Stop. That's it. Maximum.
His coag is on 1, ablate is on 9. He's coag.
Yeah.
So you gotta raise the coag.
Oh really? Then you think the oblate? 잠깐만요. You think oblate will go up? Okay, let's see if the oblate go up. So he's looking for the inferior pole of the IAP. So what he's saying is that you got the inferior pole of the facet joint. You're gonna resect that until you get to the medial margin of the lower pedicle, right? So you're gonna, as you clear out the soft tissue, underneath that will be the lamina. That's the lamina 5 as it sweeps up to become the SAP. That's what he's trying to clear out.
That's the tip of the SAP.
The base of the SAP as it forms the lamina of the lower level. You first have to get rid of the soft tissue overlying before you could get to the bone. Otherwise, the bone will not resect. So he's just getting rid of the some capsular tissues and all the other junk. That's just literally sitting right on top. He's above the lamina of 5, and just resecting away the little corner of the facets, inferior corner. That way, he knows where the medial wall of the pedicle will be.
AIP. 아이들이 달아야지 SAP가 보이겠죠.
You have to resect some of the IAP in order for you to visualize the cup of the SAP. That's what he's doing. So as he's resecting, that's the IAP he's resecting, right? Underneath that, you're gonna start seeing a little bit medial aspect of the SAP.
나중에 이제 IIT 다 달려야 되겠죠.
Yeah. When you do fusion, you literally just follow the whole IAP and resect it out.
IIT 받아버려야 되는데 그거는 일단 ULB를 하려고 하면 이 정도로 더 나가면 할 수 있으니까.
Yeah, but for the purpose of the decompression surgery, this is only as far lateral as you want to be.
보호자 맞나요?
네?
이 reverse 하세요.
The reverse.
저도 리버스
네. 이게 forward이에요.
여기가
Lamina. So he's writing on the lamina now of 5. Yeah. Right there, follow the lamina, you'll see the SAP.
네.
Yeah. So as you kind of follow along, what he's going to try to look for afterwards is the medial wall of the pedicle. So you know you've gone out lateral enough.
Okay.
Now he's going to contralateral, he's going to reverse so that when you bounce, you don't bounce into the corner.
Forward.
Forward.
네, 이게 reverse.
So yeah. 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 You see the midline detachment, so he's going lateral. You know, I made a similar mistake where I was going lateral. Sometimes you go too superficial all the way, you could actually eat the whole lamina. So you gotta make sure you stay right on top of the flabum.
Okay.
Yeah. Now he's going for the corners of the ligamentum flabum. He's just resecting more superficially so he could visualize more proximal. So he's going right towards the foramen there, you know? Right. So he's looking for the right side wing of the butterfly. Yeah, if you want to resect the whole thing once, you gotta detach the wings proximally. And then you come distally and you detach laterally. So he's probably resecting your contralateral facet, right? Or down there?
Yeah. It's their side.
Yeah. He's looking for the contralateral SAP now. So he's resecting the tissue on top. You know, the like thickened flabrum at the base of the, like, you know, where you're. Sometimes I use the RF, he says. Oh shit.
그다음에 이거는 이제 이 소프트 티슈를 제거를 해준 게 아오레오리온 플라우인데 얘가 없으니까
Yeah. Yeah, it's very important that you get rid of all the soft tissues. Otherwise, the drill doesn't work. You don't see well. And he's looking for the lower lamina, so you know the distal aspect of the decompression.
Okay. I'm looking for
Uh-oh, we need water in the back, please. Is the water? One second. What do you say? It's coming?
But it's not. Is this supposed to be?
No. That's no. The water going through the scope, but there's a lot of bubble. 물은 정상이야? Okay, that's okay. I think it's sucking too hard. That's all. 너무 많이 하면 안 돼. So you find the lower lamina right there, like 3 o'clock, and then you trace up to find the SAP. You see? See that bone?
Yeah.
That's leading to the SAP. Correct?
드릴까요? 현갑 하나 더 드릴까요?
No. 예.
안 해볼 수도 있겠어요.
아 괜찮아요. 아, 예, 계속 하세요 이번. 이따 나중에. 네. That's all lamina. If you look closely, you follow the top of the lamina, and then you'll see the SAP right under. That's exactly what we do when we do micro disc, right? We detach the flabum right off the. So that's a very shallow insertion point of flabum.
Thank you.
So that's what we normally do with the micro disc, right? We detach off the. Always find the lower lamina first, and then you follow up laterally and proximally, and you'll see the SAP. That's the contralateral SAP. You always have to find the contralateral SAP. You see that bone? That's the SAP, medial border. That's where you gotta detach the flabum off. And then you come along more proximally, then the flabum will come off easily.
그러면 이제 우리가 복수관에서 이게
So that's the proximal.
나타내서 이거 보면 이거 있잖아요. 이거 디켓시키고 그러면 이제 인피에서도 디켓해야 되거든요. 이렇게 되면 보시면 이거 보이시죠? 이거.
You see how he's just detaching? Yeah,
이걸
yeah,
그림을 많이 이번에 봤는데
yeah.
그래가지고 WM 있죠. WM은 요즘은
Correct. You want?
보면 여기 보면 이제 스티가는 플라워가 이제 크레니아를 이렇게 디켓시키고
So you want to detach the ligamentum flabum cranially. That's the midline. Drill.
큰 것이죠. 예. 저희가 한번 좀 볼까요?
So he's going to use the drill a little bit more, go proximally
한번 두번 해보세요.
forward.
포워드,
Yep. Reverse.
포워드,
Yeah, forward. Yeah.
해보세요.
네.
Reverse.
갈비는 아까 있지만 이제 위에 올라가 있잖아요. 대치가 안 되는 거죠.
네?
갈비가 위에 올라가 있잖아요. 그죠?
Yeah.
해동은 위에 있죠. 크레니아가 있죠.
So because the attachment lateral is so proximal, you got to follow that along into the foramen, basically. Yeah. Sometimes he stops there and he uses kerosene. Yeah. Yeah. So because he does a lot of thoracic and cervical, he relies on the drill a lot more than the punch. Because the punch can, cause neurologic injuries as you shove it in. So he's gonna keep going until it kind of detaches itself. Like when I do T-lift, I just go until it just the same thing. What?
The whole thing looks like it's gonna come.
No, it's okay. It's got a lot of room. So he keeps going. He could go out the foramen, man. With this, you start seeing like the whole tip of the SAP, and you can see the discect. You can do contralateral discectomy this way. Always make sure the tail is at your base and 12 o'clock, so you're not disoriented.
To use on the other side, it's better to use 30 degrees or not?
No, 0 is plenty good. Yeah.
This is 0 degree scope.
Yeah. You can see the dura at the base. And there's the remaining. That's hypertrophic SAP, tip of the SAP right now. So he's trying to detach the whole thing as one. So he's got a couple of points there that hasn't really detached yet. Punch. Where's the kerosene punch? The curve? Frame anatomy. You go straight. Okay.
여기 보면 뒤쪽에서 여기서부터 여기 들어가가지고 있잖아요. 여기를 대충 주시면 이렇게 됐죠?
Just sequentially detaching the flabum. Now he just took the whole thing off. See? And there's a little bit more remaining. 필요 없어요. 응. 뭐 필요하지? 다시? 아, 뭐랄까? 조금만 거. 어허. 조금만. It's too long.
내가 엔지처럼 나한테 인포메이션 너무 안 주는데 수로 활동을 해야 돼. 여기가 이제 보시면 자 다운핸드 보시고
더블
여기 이제 보시면 항상 보시면 반대쪽에서 타격이 있거든요. 이쪽하고 보이잖아요. 미드라인 프로필 보이고 아래쪽에 잘 보면 일관성이 잘 보이잖아요.
Yeah.
이따가 우리 드래곤 루트가 보여요. L45, L5 루트가 보이거든요.
You could see the 5 root
이게 라테럴 리세스.
traversing. That's the lateral recess. On what? Curette? Okay. There's a curette. Oh, there we go. Yeah, because it pushes down, it actually looks very deflated. Yeah, and also the water pressure actually. Even in real, they actually are deflated, which is good because it kind of keeps the dura from coming to your biting field. Punch. So he's gonna get rid of that flabum. It's blocking our view.
이건 브라보 일종인데.
Yeah, no, I know about it.
Yeah, now we see better. Correct. Yeah.
여기 미드라인 프로컬. 그리고 여기 반대쪽에 있는 아탈리시스가 여기 반대쪽에.
That's the lateral recess, opposite. That's the base of the SAP. As you go, you'll see the medial wall of the pedicle on contralateral side. That's the beauty. You can literally get down there and see everything. So what he's doing is just taking off the tip of the medial wall, the medial aspect of the SAP to get to the medial wall of the pedicle. He likes using curettes to resect the bone.
Yeah, you have to have a sharp curette.
Yeah. Punch.
피추타리는 없죠.
예?
피추타리가
피트 있어요. 여기. 옆.
이렇게 보면 이제 요거를 얘도 넣으면 되고.
No, it's okay.
아 이거 교수님 나와.
예.
여기 이제 SAP.
So he's resecting the lateral recess.
Yeah, SAP lateral. And 여기 나가는 부분을 넓혀줄 수가 있고요.
So he's enlarging the lateral recess right there.
여기 보면 이제 패스 잭슨이 여기 밑에 루트로 볼 때.
You should be able to see the root underneath as he's kind of peeling off the epidural fat. We see that, yeah, the red.
같은 거 우리 좀 굉장히 좋아요. 그래서 이렇게 했는데 여기 반대쪽을 이렇게 건물질하고.
Oh, hair. How the hell did I get in there?
이거. 다음에 이렇게 해서 이제 반대쪽을 이렇게 충분히 이렇게 컴프레션 할 수 있는 거예요. 이 보면 이
So now you see the lateral border of the root right there. That's the medial wall of the pedicle where it's touching.
L5 root, traverse root.
Oh, okay.
Yeah, and here is the extra. Here is shoulder over L5 root. Here is the extra over L5 root. Okay?
Okay.
And now you are moving to the ipsilateral. Usually contralateral decompression more easy for the bipolar. Contralateral side more easy because the angle is infused more good. But ipsilateral is difficult, more difficult compared to contralateral side. 이거 여기서 저기서 해야 되겠다.
Yeah, he needs to resect a little bit more bone there.
여기 보고 left side 위로 expose 해야 되겠죠.
Yeah, he's gonna expose a little bit more of the bone.
미끄러우시면 좀 봐주세요.
Hannah, look, reverse right now.
이거
Oscillating forward.
돌리면 들어가기 쉬운데, 아, 이러면 안 되는데, 딱. 아, 들어갔으면 되고, 요거를 다이섹트가 당겨주면서, 원래 트로카가 있으면 얘 가지고 요거 속부터 당기죠.
Normally, he uses his own troll card to get those tissue out of the way, but he doesn't have the right tool.
이렇게 당기면 되죠.
He's gonna kick Andy Choi's ass later.
근데 이거를 교수님도 이거를 시켜서 저도 이거 되게 어려운데.
Yeah, so even for him, if he doesn't have the right tool, it's harder.
여기가 이스라엘
So he's shaving a little bit more of the lamina of its lateral side.
It's for the left side.
How do you know you're not too lateral? Because you're looking at the midline.
Always goes and yeah, because 이게 보통 드리핑 하나가 4mm잖아요.
So you know the drill is 4 millimeter in diameter. So you know where the midline is. Then you kind of measure. So he says that don't go too much above the width of the drill from the midline. Yeah. Now we again look for the SAP on that side. That will also tell you how far lateral you've gone. He's shaving up the IAP. So what he's saying is that do not detach the ligamentum flavum when you're drilling because it's dangerous. You could, shred the dura. It's the barrier. It's a protecting barrier always. You always take it out at the end when you're done the bony work. Yeah, that's one thing I noticed from every one of them. They always leave the flavum at the end, until the end. So you see the lower lamina there. Right, see that bone? That's the lower lamina. Yeah, the ligamentum insertion there is always thin and shallow.
You just take that until it pops up.
Yeah. He sometimes uses curette. Where he's Hannah, ablation 0 now. 잠깐만 지금 공으로 다시 됐어요. 끄세요. 돼요? It's okay. Oh, interesting. No. Then you see the low lamina, right? Now you just hug that along laterally, then you fall into SAP. That's how you find the SAP. Boom, right there. Yeah. The pedicle is right there, as you know.
여기서 보면 이 앵글 있잖아요. 이 앵글에 한 4mm 안쪽에 있는 게 페디클 미디얼 월이에요.
That corner is the medial wall.
around 4mm about.
About.
무슨 말이냐면 이 코너가 SAP가 시작한 코너 베이스가 있잖아요.
That's the base of the SAP, junction of the lamina.
보통 여기서 한 4mm 안쪽이
You go more 4 millimeters laterally, then that's your medial wall of the pedicle.
근데 이제 우리가 보통은 이제 디스토전 되고 하이퍼트로피 되고 나이가 되면 오버래핑 되고 막 엉망이잖아요.
But as you get older, you get hypertrophy and whatnot, so it's variable. Yeah.
그런데 항상 요 앵글은
But that's always constant
왜냐 우리 페디클이 틀어지는 경우 거의 없잖아요.
because the pedicle is always constant. Pedicle doesn't hypertrophy, that doesn't hypertrophy, so that's your landmark.
여기는 하이퍼트로피가 안 오고 페디클도 안 오니까 여기 있잖아요. 여기가 요거에도 바깥쪽으로 나가면 파셋을 같이
Yeah, you can't rely on the facet joint as your landmark because it could become hypertrophy, but this is constant. So you got to find that to realize where your lateral motor is.
이 파셋처럼 엉망이 돼 있어도 도대체 우리가 뭐라도 무조건 요거만 찾아가는 거예요.
Even if the facet is all over the place, you find that you're good. So that's the 90-degree angle. So you just peel that off, and then the disc should be right there. So because the SAP is underneath, when you resect the IAP, even if you plunge, the SAP is going to protect. And then you just detach from there and you're done. Now we got to do interbody fusion.
인터바디 퓨전하려고 하면 사실은 이제 요거를 이 정도 하고 자, 끝까지 보여드려요. 이것까지 다 보여드려요, 교수님. ULB도 해드려요.
Yeah, 이거 다.
그러면 교수님, 요거 드릴을 알았어. 그럼 이제 요거를 이제 이거 좀 소프트 더 달아가지고.
Now, are you gonna do the fusion now, or?
퓨전도 보여줘야 될 건데요.
Okay, yeah.
ULB도 먼저 하고
Okay.
보여줘야 될 거예요.
Yeah, so he's gonna finish decompressing, and then he'll.
퓨전 해주려고 하면 퓨전 다시 해줘야 여기까지 왔는데. 근데 퓨전은 교수님 시즌을 이렇게 넣으면 안 돼.
그렇죠. So what he's saying is that if you're gonna do fusion, incision point is too medial. This is too medial.
퓨전 하려고 하면 스킨 시즌에 페디클 스크루까지 넣을 걸 같이 활용을 해야 되거든.
Because you got to utilize the incision for the pedicle screw insertion too, so it's way too lateral.
아, 오케이.
Right.
그래서 이제 스파이널 캐널에 스테노시스가 있으면 좀 이야기해봐야 되죠.
Yeah.
The other point is a little bit lateral.
Yeah.
Yeah, when you want to fuse.
Yeah, and decompress at the same time.
이제 만약에 이제 환자가 센트럴 스테노시스가 있고
If they have a central stenosis and lateral recess stenosis,
두 개 다 해야 되잖아요.
if you want to do decompress and do the fusion,
두 개 다 하려고 하면 이제 인시전 그러면 인시전을 옹격수로 해가지고
네?
인시전을 버티하게 돼.
so when he does fusion, he does vertical incisions,
버티고 스키는 인시전 스크루도 받고
so that he could pass the rod and do the screws and whole shebang. Right.
하면 이제 우리가 시암을 가지고 페디클 위치를 잘 그려야 돼. 페디클.
So you use the C-arm, draw the pedicles.
페디클 위치를 잘 그려가지고 제가요. 이제 우리가 포라멘이 컴프레션이 많다. 포라멘까지 디컴프레션 해야 된다. 포라멘.
If there's a lot of foraminal compression,
스킨 위치를 페디클 라테럴 월에 맞춰가지고.
then you skin incision should be lateral wall of the pedicle.
라테럴 넣고 우리가 보면은 이제 페디클 어퍼 마진에 디스크 스페이스 붙여 있잖아.
Right, the upper margin of the pedicle is where the inferior aspect of this space is. Yeah.
그래서 워킹 포트의 스킨 시간이 요 디스크 스페이스를 포함해야 된다고 포함을.
So it has to include that working space for the. It has to be lateral and proximal.
스킨 시즌을 가지고 스쿨 케이지를 이렇게 넣을 수가 없잖아요. 항상 케이지를
Right, the cage has to go straight. You can't go in an angle. So
스킨십 잘못돼가지고 뭐 여기서부터 여기까지 돼 있으면 케이지를 당기가 넣을 수가
Yeah, if the
없어요.
incision's too low or too high, you can't put the cage in straight.
그래서 뭘 하냐면은 항상 라테랄을 봐가지고 디스크 스페이스하고 패럴하게 시암을 잘 쏘아야 돼요.
So make sure you get the lateral C-arm so that your working portal is straight in line with the disc.
예. 그 디스크가 이렇게 서 있느냐, 포파이브가 아래쪽으로 돼 있느냐, 위쪽으로 돼 있느냐 해가지고 스피니시를 잘 넣어가지고 항상 디스크 스페이스를 포함해가지고 이시를 넣어야 돼요.
So that you incorporate the incision along the line of the disc so that you're not struggling to put the cage into the palate.
그 임파서블 하니까
That's impossible.
케이스 스페이스가 딱 패럴하게 해야만이 들어갈 수 있다는 걸 확실하게
It must be parallel the working portal.
그게 제일 중요한
That is the most important point. I feel like a pastor and like a evangelical 목 나도 목사 이렇게 통역하는 설교할 때.
어떻게 계속해요?
계속하세요. Okay.
근데 만약에 안제가 이제 센트럴 캐럴 스테어스가 있다면
If there's a central stenosis,
센트럴 스테어스 우리가 유혈비를 해야 되잖아요.
then you have to perform the bilateral decompression.
네, 그러면 스킨이 너 바깥쪽에 있으면 확실하게
If the lateral incision is too lateral, then it's hard to decompress.
그러니까 이때는 뭘 하냐면 페리클 밀리알 쪽에다 스킨이 쓰면 여기 써야 된다. 그래야
So in those cases where there's more central, then he makes the incision medial
밀리알 페리클 뭘
wall.
여기 시절 이렇게 넣어야만 유혈비도 하고 당기가지고
That way you could do contralateral decompression and you pull the skin a little bit more and you could do the interbody fusion.
두개 달로
You could do both. So it's more utility. Whereas if it's just foraminal stenosis, then you do lateral. It's easier.
그게 중요한 거예요.
It's very important.
그다음에 뭐 했던 그렇게 되었잖아요. 근데 이게 이거 온도가 있으니까 근데 제가 그러면 이제 케이지를 넣기 위해서 이게 나와 있으면 여기를 넣으면 물이 다 빠지니까 수술이 안 될 거예요.
Right.
조금 바깥쪽에
Okay.
넣어가지고
So normally he would make the incision medial wall, right? Because you would decompress centrally and do the interbody fusion. But because we already made this incision, if I utilize this incision, the water is going to leak. So he's going to just use the lateral incision.
여기 넣고 한번 해보자는 거예요.
And then he's going to attempt.
그렇지 않으면 그러면 한 년을 위에 바로 해도 되고. 포파 3-4 해도 되긴 되는데 3-4 하기도 편하긴 편해요. 왜냐하면
물이 나올 것 같죠.
다 빠져. 해보고 안 되면 하죠.
So he's going to try it, but he's concerned that the water may leak to the previous incision. If that happens, then we'll just go up to 3-4.
오케이. 그래서 이제 제일 중요한 건 디스크 스페이스로 포함을 시키면서
Incorporate the disc
그다음에
space
이제 스피드를
and then
넣어야 되는데 파스를 자르면서 좀 커야 돼. 왜냐면 페이지가 들어가야 되잖아요.
the fascial incision has to be big enough to incorporate, allow the passage of the
그래야만
cage.
이제 이게 페이지로 들어가야 되고 그다음 여기 들어가가지고 뭘 만지냐면은 파셋 조인트를 바로 만졌어요. 들어갔어.
So once you go in there, what first thing you feel is a facet joint,
파셋 조인트 라테랄 월을 이렇게 만질 수가 있거든.
and then you feel the lateral wall of the facet joint.
그리고 파셋 조인트를 싸고 있는 볼을 마스를 좀 디테치 시키고 어차피 디테치가
Yeah, and you start detaching the muscle of the facet joint.
그리고 파셋 조인트 인피리어 폴도 만지고
You feel the inferior pole of the facet joint, medial pole, laterally.
라테랄도 만지고 이렇게 해서 이제 챔버 어떤 챔버를 만드는 거예요.
You're creating a space right now.
이렇게 만들어가지고 한번 해보실 때 만지셔야 돼요. 라테랄 볼. 너무 깊게 넣지 마시고 이 정도에서 만져보시죠.
Yeah, so here's the lateral wall. We're going up the facet, medial, inferior, and up. Yeah. So I guess you're going around the circle of the facet.
파셋 조인트를 그냥 아이솔레이션을 시키면서 나오고요.
You're isolating the facet joint
어차피 파셋 조인트 제거해야 케이지를 넣고 될 거니까요.
because it's gonna go anyways, and you're gonna put cage through anyway. So
이렇게 해서 만들죠. 그다음에 여기도 이제 에도스코프 포트를 넣어야 되는데 요거는 뭐 그냥 넣으시면 돼요. 그냥 해가지고 아까 이야기했지만 이거는 에도스코프이 들어갔으니까 이렇게 넣으시는 거예요.
separate portal for the endoscope.
통과돼요. 물이 안 고이니까 안 돼요. 항상 이게 남겨야 된다고.
Yeah, you always have to have a skin bridge, otherwise the water will just leak out.
이게 완전 열려버리면 챔버가 안 만들어지잖아요.
Yeah, you can't make a chambers.
우리는 이제 챔버를 만들기 주목적이니까. 그 다음에 똑같이 이제 요걸 해야 되고 아니면 뭐 이거 작은 거 그런 거 가지고 이게 너무 커도 물이 너무 빠져도 독이 있거든요.
Sometimes you don't want too big.
이렇게 해서 얘를 넣고 그 다음에 얘 여기가 이거 터널링 하시란 말이에요.
And then you're gonna kiss.
터널링 하고 그 다음에 이제 여기다 엔도스코프를 넣어야 되겠죠. 그러면 엔도스코프를 이렇게 해서 엔도스코프를 이렇게 넣는 거예요. 엔도스코프 넣을 때 이제 터널링 하는데 제대로 넣어야지 엄청 넣으면 또 흔들리고 이렇게 있으니까 이게 트렁크가 있어야 돼요.
This is where the choker comes in very handy.
이게 엉뚱하게 그럴 수가 있거든요. 그래서 잠깐만요. 얘 해가지고 좀 똥을 넣어요. 얘를 먼저 따서 넣고 그 다음에 얘를 넣어야 제대로 들어가겠다. 그리고 물을 쓰고요.
Put in the water.
그 다음에 이제 브레시나 뭐 이런 것도 되고 아래 거 되고 똑같은 방법을
Same as before.
똑같이 이렇게 해서 키싱을 시켜야 돼요.
You kiss. You find the probe.
이렇게 해서 키싱 시키면 바로 나오잖아요. 찾았죠?
Is that facet? Where are you?
그다음에 여기서 이제 가셔서 찾아가야죠.
You have to find the facet now.
여기 이대로 찢으면서 이렇게 해서
You burn the tissues around you.
툭툭툭 쳐보면 보온이
You palpate for the bone.
툭툭툭 쳐서 이제 보온을
You keep hitting to feel for the bone.
페달이 없는 거 뭐예요? 페달이 없어 너무 불편하다. 완전히 두 손 들고 싸우라니까. 이거 보면 이제 지금 치면서 이거 보면 이게 파세스 스포즈에서 잘라내.
So he's exposing the lateral of the facet, like the whole.
포커스 같이 맞출까? 시스템을 쏴줘야 돼. 잠깐요. 그래서 검증을 잡아야 돼. 검증을 잡아야 돼. 검증을 잡고 돌려보세요. 예. 검증을 고정시킬 때 위에 캐로 돌려보세요. 예. 되돌리고 됐다. 흘렀죠. 조금만 더 맞추고 그래. 검증을 잡고 돌려가지고
네.
최대한 잘 보시고.
잠깐만요. 이건 아니고.
검증을 잡고 가방에 돌려보세요. 가방을요.
예.
안 돼요?
요게 최고인데?
아,
요게.
그래요?
예.
여기 보면 이제 파세 조인트가 보면 이게 이제
Is it the lateral wall of the facet?
야, 그래서 파세 조인트 스포즈 시켜야 되겠죠. 그리고 이제 TP 여기 보면 이제 TP 제 upper TP도 좀 또
Now he's hugging the TP or the upper,
upper TP
bottom of the upper TP. That's the TP right there.
TP 따라 미드에만 파세 조인트 만났거든요. 미드에 그 부분 사실 여기서 이제 우리가 해야 될 거는 파세 조인트를 스포즈 시켜야 돼요.
So he's exposing, basically getting rid of the capsules and all that stuff off the facet.
이렇게 이제 찾아가지고 가야 되는데 이게 이제 실수해서 이게 처음에는 마세스 미드라인을 넣고 한다고 인터 아니야로.
If you're not careful, sometimes you go across to the midline, so you got to be careful.
여기서 이제 우리가 찾는 게 중요하죠. 찾아야 되는데.
So he's still looking for the whole entire facet right now. That's the important part.
좀 더 만져봅시다. 이게
So he wants to palpate around and say, where the heck am I?
여기 아까 우리가 했어. 도저히 안 되면 이제 여기 안에서 차고 이게 레토미가 좀 복잡하면은 안에서부터 차고 나오는 거예요.
Sometimes the anatomy is confusing. Then you could go where you decompress and come laterally rather than going lateral to medial.
미드에서 나타나는 착긴 합니다.
So he's
여기가 아까 여기 우리 라면 보는 그 자리가
This is our previous laminotomy defect there.
확실한 거 보고요. 그리고 여기 인피를 봤었으니까 인피를 잘라야겠다고요.
Yeah, that feels like IAP there.
맞는 걸 확실히 봐야 되고. 뭐든지 확실하고 가야 되는 거죠.
You have to be very certain where you are.
그리고 시험을 쓰는 거죠. 헷갈리는 시험을 제대로 하니까 시험을 풀어주시죠.
Yeah. So when you're lost and confused, then you get a C on. Can we get C on this side? Yeah, on this side.
This part's a little bit confused.
Yeah. Then when you're confused, you get a C on. Make sure you know where you are.
이제 리트레이트만 있으면 제가 금방 날아다닐 건데 리트레이트가 없으니까
Yeah.
이게 인피를 갔죠. 시험 왔나요?
It's coming. Okay. Lateral 같아 보이죠? Looks lateral.
Any of us will do it.
지금 미드라인 쪽이 아파.
Okay. That's good. That's fine.
So my second case I did it with the nav,
Oh, okay.
which makes this much easier. Oh, here I am. So there it is. Okay.
그래가지고 CP가 맞았어요. CP가 맞았고 지금 빠져는 나이
Yeah. So he's
문제는 이제 우리가 이게 455에서 봐야 되고 지금 45 아닌 것 같아요. 저 밑에 있거든요.
so. Can you come to lateral? That looks like he thinks he's a little too low. So he's gonna have to move up his.
맞는데 CP 더 위에는 오케이 빼주세요.
Oh, you could come out, please. You could come out with the CM.
Thank you so much. There you go.
So he has to find his probe. Okay, now. So he's looking for the TP of L5. Yeah.
Ele entrou na nave, vai até aqui de que vai fazer fusão. Eu já faço isso lá. That's the lateral of the facet joint. Which TP, L5 or L4? L5, he's looking for the L5 TP. That's going to lead you to the pedicle. So you have to find the L5 pedicle because that's where the disc space is going to be, right above. Okay. You can feel the transverse process.
He's looking for it right now. Right there, he felt it. And that's the disc space. Now he's looking for the upper TP. You could take the whole facet out and do transforaminal, or right, you could do a little bit more medial. Yeah, that's pliff. Yeah. Forward, yeah.
You're shaving the lateral wall of the facet. Okay, reverse. Oh, good. No, one more. Yeah.
In this case, it's better to reverse.
Why you using reverse this time? Uh-huh. Okay, so when you go forward, the soft tissues get wrapped into the drill, so it's obscuring his vision. So right now he's using reverse because it pushes the tissue out of the way. So that's the reason. You see the plane of the facet joint there? 어느 거요?
요거 가지고 좀 서브 줄 수 있을 것 같아요. 여기 보면 잘 보시면
You see the little cartilage space?
이거 찍어봐 있어요. 이거 보면
Okay, so now intact.
Yeah, you see? That's the tip of the SAP right there. That's the IAP. Yeah. Yeah? Chisel? We don't. I don't know if you have chisel. We have chisels. Chisel. Osteotomes.
요걸 잘라야 되잖아요. 이게 SAP거든요, SAP.
Yeah, that's the SAP IAP.
SAP IAP 잘라야 바디포인트를 달리고 그 다음에 뭐가 나오냐면 디스크 스페이스 있고 그 다음에 베이징을
여기 치즈 여기 있어요. 아스토.
해보 있나요?
Mallet? You have a mallet? Oh, got it.
이게 치즈링 할 때 눈 크게 하면 드라프가 안 나오거든요. 작은 쪽 하려면 이렇게 해야 돼요. 방구색이
Why am I going forward?
그치리죠. 그렇지. 그렇지 않으면 너무 다치니까.
Yeah.
여기도 가면 그 다음에 프렉스 있을 거예요. 그다음 또
He says not to make the bony fragments too big because then it's hard to get them out. And then you fracture them.
This one?
근데 그 펜을 제대로 왔어.
You want to
Close to the pedicle, the bottom pedicle.
이렇게 해서 이제
Pituitary, where is it?
이렇게 해서 우리가 가색 조인트를 없애줘야 디스크 스페이스가 나오고 우리가 힘이 터져 있는 경우가
And then that comes out.
자, 이렇게 해서
And this. Well, so there's different ways of doing it. You could, but I have them on the back table. I have them on the back table pre-filled.
여기서 이제 우리가 헤드스 내절볼이 나와줘야
This is the
헤드 어퍼를 찾고 어퍼를 찾아야 어퍼에서 가능하죠. 그걸로 IAP도 쳐버리죠.
Okay. He's gonna osteotomize the IAP now.
Yeah. So I have two of these pre-filled on the back table. Two of the LCC. What is this for?
그래는 엄청나게
And then we'll also list the graft nozzles.
Yeah, so that's like I squirt, get a section, put it in the bottom, squirt.
Yeah, he took the SAT outside, everything outside, he's gonna right down. Right, so he's the outside.
What are the trials? These are the trials. You already did this trials? These are the trials.
He already said, and then because he's in city.
I just go off of my shape. Whatever chair. It's an extra step. It's not necessary.
그거를 풀면 안 되는데 대그는
That's the right way to do it.
얘들이 다 나가야 돼. 아래
Where is it?
아래쪽하고 넷을 맞는 아래쪽도 체력이 다르고 이게 돌림이 많아가지고
Andy, you have another RF probe. He needs another RF probe.
Our probe isn't working?
It's too dirty, too burnt. Does he have another one?
이거 아
So when it hits the word lateral, that means it's over.
이렇게 좀 하면 이제 우리가 아까 왔던 브라벨 나오고
Once we keep going, we're gonna meet the previously decompressed area.
오케이. 아래 거 누구 안 들은 거?
This RF is not working so well.
완전히 렌즈로 싸야 돼. 요 아이를 이런 스페이스 나오고 제대로 해야
Our throat's coming, doctor. New RF, yes.
Yeah, it is not more powerful RF.
Let me know when you're ready.
He doesn't have the right tool. I'm sure he's probably pissed as hell because his haze is low. He should be already like spraying the cage by now, but he's like, I feel like I'm at a battle fighting with my fists.
Thank you.
You're welcome.
That's the lamina, other side. That's the defect. He thinks that's where it is. That's where we had done the prior decompression. So he's come across. He's still got a sliver of IAP remaining. Looks like. So he's just getting rid of all the soft tissues. Drill? You want to drill? Okay. 줄도 바꿔달라 그래요? 잠깐만요. Okay. Okay. 네, 줄이 자꾸 reverse. No, one more. Okay. You going back out to Greenport?
I'm removing soft tissue. 그래서 우리가 이제 임시에 달고 나올 거라고 생각하고 있어요.
지금 티슈가 너무 많이 껴가지고 아무것도 안 들어갔는데.
케어를 바꿔주시면 될것
이거 바꿔다 팁을?
팁을 좀 찌꺼기 깨내야 되겠다.
오케이. He's on the central canal now. We're there where we were before. He just has to resect that more, and then the IAP will come out. 어느 거요? 이거 다 뺐어. 다 뺐겠어. 오케이, 한 번 더 누르시면 forward 되겠네. 네. 아. 오케이.
무슨 실수도 넣어야되는데. 아씨 미치겠다 이거.
왜요?
아니 돌려가면 실수 누가 눌려야 되는데 내가 누르면 또 이게 또 쳐버리거든요. 위에 거.
왜?
밑에 이거 반대쪽 보세요. 그거 눌러보세요. 하나 더.
Just resecting the remaining IAP.
이거 라면하고 같이 가야 베이스가 나오고.
Sometimes can you do it this way? Just come from medial to lateral?
Yeah,
Usually, not this other way.
Yeah, this is for the foramen narrowing, only foramen narrowing.
Right.
But most of patients in central canal narrowing.
Right. So you come this way. Easier.
Easier to lateral. This way. It's much more easier.
Much
But it's
easier.
difficult to go to the other side.
To get the foraminal.
To the
Yeah.
other side.
foramen decompression하고 지금까지 해야 되거든요.
Yeah.
foramen decompression apparatus 좋아야 되고.
Yeah. So if you want to do foraminal, like extra foraminal decompression, you got to come out from lateral to medial. But most cases are central, so then you could come from medial to lateral, which is easier. Yeah. Okay, forward. Okay.
하면 내가 잠깐 여기 팁을 찾아놓고 있는데.
Uh-huh.
아까 우리 갈등부 있어요. 채워줘. 내 무게 내가 챙겨.
Can you pull it? Yeah.
잠깐만요. 지금 아까 그 볼 있잖아요. 볼 채워.
That's lateral. That's where you were before.
이거 라테랄이고.
Yeah.
아까 우리가 찾던 부위 있잖아요. 빨간 부위.
거기.
얘를 날려야 얘 IAP하고 얘를 날려야 얘를 날려야 되거든요. 얘를 날려야만이 디스페이스가 여기 있거든요. 요거를 치야 되는데 치질 수
취소?
잠깐만요. 아래 거 먼저 아래
어느 거요?
아래
Alright.
그 다음에 치질을 쳐요.
Okay.
Sorry. Dr. Kwan, can I help you? Yeah, I stole them from you. No, there they are. Yeah. 7.
Yeah, go to set it up to 9. 아직 잠깐만요. Stop하고. Okay. Full power. Go yellow button. 잠깐 stop. Okay. Good. That's it.
여기 치면 치면
Pituitary. Where's the pituitary? Here we go. Small one. They're small. Here they're all fighting. The bone is too big.
요걸 떼줘야 우리가 투쟁할 수가 있거든요.
Oh, it's much bigger than it looks on the TV screen, huh?
The knee. Knee joint.
Now he's looking for the medial wall of the pedicle. That's the top of the SAP. That probably looks like medial wall. He's looking for that lower lamina again. There it is.
이게 보시면 우리가 수리해야 될 때
Yeah, he needs to get rid of that remaining tip of the SAP there.
Okay.
What do you need? The drill?
이게 디자인에서 이제 그랜드를 잡고 나오니까 대단한 게 아까 ILP를 이렇게 사용을 놓으면 어느 선에는 넣을 수가 없어요. 이렇게 보면. 아까 우리가 바깥에 지나면 한 대는 위에가 봐요.
네?
우리가 직접 했더니 한 대는 위이고 여기가 보였어야 되는 것 같아요. 아까 우리가 바깥쪽으로 지나면 이 짝지가 여기서 바깥쪽으로 치고 나가가지고
So he's resecting the remaining SAP there. IAP. Remaining IAP.
계속 바깥쪽으로 나오면 이제 ISP가 부실해지고 SAP 바깥쪽으로 남잖아요.
So as you finish resetting the IAP, you'll see the remaining SAP. Yeah. And then that will show you the disk.
우리들 시고 나온 방식으로 작성을
Were you guys able to do interbody? Did they do it?
We no, so at first we thought we couldn't, and then when we got to the space and we got
SAP,
the shapers, our cadaver.
you have to open my 수표 롤 하면 보이죠?
Yeah.
이걸 갈아가지고 헤드 오픈 맞으면 스포츠 하고
What? Punch? Kerosene? Where'd it go? That exploded.
Yep, from the belly.
They're eviscerated, so there's a whole.
Oh. Oh, from the water that went down. You know, that is a known complication, especially if you.
이게 IP를 붙이기 위해서
I've been trying to get me in.
Shit, the damn thing broke. Hey, it happens around me all the time. Where's the pituitary? Yeah, yeah. In one case.
They broke. I don't think we were being excessive.
Something broke, but that's half of the blade broke. Chisel?
Do we need another 3 kerosene?
Yeah,
Or is that a 2 kerosene?
this was 2. But how do I get this damn thing out?
Push him clockwise until the arrows line up.
Yeah.
Size 2 kerosene.
Okay, thank you.
거기에 지금 IP를 제거하고 SAP 있잖아요, 이거.
Yeah.
SAP 500도 달아야 되면 우리 그 캔디 오픈 마지막 펀치 나와 계속 펀치 나왔나 이렇게 계속 펀치.
So the most important thing is right now finding the disc, figuring out where the disc is.
스페이스 알아야 우리가 패턴을 만들 수 있는데 스페이스 알기 위해서 패턴이 있어.
So in order for you to find the disc, you got to find where the medial wall of the pedicle is. And I think it's right there. It's probably... So he's just resecting out the lateral inferior lip of the SAP to get to the pedicle. Double in. 왔다, 이거 돌아갔네.
I think this space is there.
고장났어. This is no good. Yeah. Pituitary. 근데 이 펀치가 잠깐 돌아가네. Hey, you have another punch? This thing keeps rotating. Yeah. Okay. Here we go.
어떻게까지 우리 표현해야 돼?
예?
어떻게까지 우리 표현하자고 표현까지 가자고요. 포기하지 말고. 다 왔을 때. 여기 보면 드랩을 찾았잖아요.
So you found the traversing nerve root, right?
Yeah. 그럼 여기가 페디컬 대자를.
That's the medial wall of the pedicle. That means
그다음에 페디컬 어퍼 마진 여기.
that's the upper margin of the pedicle,
여기가 디스크 스페이스.
and that should be the disc space. So he still has that stuff remaining there.
여기서 요거 좀 나오고 땡기고 스페이스 만들어야 돼.
Yeah, so you just gotta resect a little bit more laterally and forward.
400원 많아. 거기도 마음에 듭니다. 자기 문제 자기가 생각하는
그냥 이제 열고
네. 지금 SH를 받아가지고 스페이스를 익스포트하고 있습니다. 아마 그 일본 지역에서
Around 7 o'clock is where the exiting route will be. We already did the central decompression.
그러니까 드릴로 이제 이거 arthroscopic 드릴로 이제 익히는 거를 좀 makes me scared. 겁나게 하잖아.
여기 쓰면 안 돼. 뺏기지 않겠어. 근데 너무 비싸게 주자. 이거 내가 아마 수라고 안 맞았는데. 여기는
Yeah, that's clean. That's safe.
That's safe.
그 정도 많이 나오겠지.
That's this space over here. Right?
Yeah.
Yeah. 12시에 그 디스 스페이스죠.
보고 있는데 이거 디스플레이스잖아.
야.
여기 색깔색이고 이 숄더에 있잖아요. 페디클 메달볼이 동력의 메달볼이고 어퍼마지 페디클 어퍼마지 얘기고 페디클 어퍼마지 붙어 있는 게 스페이스잖아요. 여기가 스페이스가 아래 교수님 손님하고 교수님 아래 부탁합니다.
You see the exiting route there above? You see that? The glimpse of it? Right there. So remember when you cut, I go, don't go back there. The earth is right there.
That's a great Camden's view right there. Perfect view. Any of your
No, he is frustrated.
I was like,
여기를 찾아가지고 누르면 말랑말랑 해야 되는데 왠지 말랑말랑 하지 않는 게 너무 애매하고.
Yeah, I think it's a little lower down there. You still have a little overhang of the SAP. That's probably the double and so I think that's the M plate right there. That's the M plate.
But I don't know why it's in the phone.
I think you still have a little bit of SAP overhanging over the disk
I
space.
don't know.
That's the M plate.
And
M plate. That's gotta go a little bit more.
shouldn't that be
Yeah.
need a power wall right there?
But he had a plump disk space. Yeah, that's the annulus orientation right there.
Ours was cranial too though. So maybe
There's still a little bit more disk.
Close to fine, no?
did you see the Indian knife, the long one?
S1
You seen the Indian knife? It's a long one.
레벨이
Mm.
여기 디스크 스페이스 요거 디스크 스페이스 같아요. 들어가거든요. 여기 디스크 스페이스 아마 이 파일을 써주나 봐요. 이거 디컴포지션 안 되는 이렇게 나와요. 이거 보이죠? 들어가거든요.
Yeah.
이렇게 넣으면 되니까요. 쉐이브 같은 거 없죠. 저는 여기를 싹 깔아가지고 여기를
You have a paddle shaver?
Yes, sir. Yeah, they're back. Oh, yeah. Ready to go.
세거 돌려가지고 공간 만들고 아마 이게 우리가 디컴프레션 하려면 밑에
Size 6.
Yeah, thank you. Size 6 and size 9.
Size 7. Size 9.
Size 6, 9, and 12, please.
Size 9.
이게 거기가 더 여기가 들어가지만은 들어가야지 맞나요?
Forward, yeah. 눌러요.
왜냐면 이제 세기가 지지배만에 들어가기 때문에 이 공원이 수주로 돼 있으면 세기를 넣을 수가 없어요. 그죠? 우리가 세기가 5번까지 들어가는데 얘가 좀 살아줘야. 한번 더.
They just unplug the machine. Yeah, I can just unplug it, plug it back.
Six.
예, 예. 잠깐만요. Here, yeah.
Nine?
9.
9? Okay. This is 9. Mount, you want 톡톡? We must be at the wrong level. 5-1. Angles all messed up. 더 세요? 쳐요?
시험 프레스. 이게 레벨이 어딘지 모르겠네.
Siam?
원래 여기 안 나오는데.
네. 야.
우리 거라면 앵글이 이거 이 앵글인데 이 앵글이 제 앵글이 아닌데 이거. 왜 스페이스가 좋지? Be careful.
Raise the tube.
Perfect.
조금 이따 위에 내면 확실하게 시험 바람이 흐릿흐릿 나는 거예요.
Lateral or AP? One.
AP
AP first, please.
Well, Ferguson is straight up.
We'll see what that straight.
I'll pass one. Okay.
gotta raise the table.
I did. We're up.
Oh.
우리가 그래서 선크림을 뚜껑을 한가 봐요.
No, it's perfect. Yeah, yeah.
Okay.
We could come out with the machine, please. Wrong level. Sorry to him.
시험가 훈련을
Yeah.
하니까 이 정도면 잘하는 거죠. 그 디스크 제거하고 페이지 넣어야죠. 페이지 넣는 걸 할 줄 모른다. 그거 뭐야? 엔진 와야 되나? 누가 해야 되나? 어떻게 해야 되지?
네? 점심을 먹고 하는 게 좋을 것 같아요. I think we're gonna break for lunch and then come back and finish insert cage. Fresh level. How's the business? 제가 많이 넣었으니까 좋거든요.
Food is tasty. Whoa, where'd you get this from?
Then you gotta watch out for the
예? 나는 원래 이 출신이 상놈이라서 제 펠로가 그 김해 나왔으니까
So how you been doing? It's been 10 years.
Yeah. I remember. That's when I must be like 6 or 7.
Yeah, it must have been at least 4.
Because that's when time flies.
Yeah.
So you're in your last year?
I'm in my fellowship
Yeah.
here, which is 1 day, right?
You said, and then
Yeah.
making some money.
Well, I have to find a job first. So. Well, if you have any,
Yeah, I'll ask around. I'll ask around. Okay. 아유, 고생이 많으셨어, 오늘. 전투에 그냥 우리가
그냥 외국인 내가 생겼어.
효과 정도는. 저번에 그때 또 같이 오셨어요. 나 좀 많이 먹었어. 그때 저녁. Yeah, cola. Yeah, he's oh yeah. You know him?
Yeah, I do.
Are you also Nigerian?
From Ghana.
Ghana.
We were finished the same time.
If you're Ghana, then you must know our old fella. What's his name? He finished about 4 years ago. No, he went to Texas. He was in Austin for about a year or so, and then he went up to Rochester. Little one though now. Good looking kid.
Yeah. I know what you're talking about. I can't think of his name either.
Yeah.
Okay.
But yeah, he's
Is he the same hospital or
So Kola does some of his cases at the main campus, but he covers Brooklyn. Yeah. Yeah. And then he started covering spine trauma in Jamaica, which is our level 1. He's been splitting with neurosurgery. He's gotten busy with that.
You know, I realized that my grandma in New York is actually a pastry here. Actually, all of her friends do. They talk about you all the time. And my grandma's best friend, I think, did an infusion on her. Yeah.
You know, there's old people, right? They may do okay, but as the years go by, they break down.
Yeah, right.
And so, like, oh,
Yeah.
you know, so and so had surgery with you. Like, oh, good. How's she doing? Oh, terrible.
I haven't seen her since. Obviously.
No. It's true. Like, they do great, and then like years later, they have recurrent pain or whatever. Yeah, I like a lot of my colleagues have been great.
Gotcha.
So I actually had to not one of the main reasons I left. One of the reasons I left my old church, which was the biggest church in New York for Korean American.
Really? Yeah.
I couldn't go to the service because literally after the service, they'll form a queue. They'll form a line.
Because they're your patients, or
no, they just want to ask me questions.
Oh my God.
Like, no, like I have back pain. What do you think? Come and see me. And then the pastor would like cut the line. I'm like, I can't go here.
So, do you get a lot of Korean patients before because you're Korean? Or?
Only reason is because I explored that angle when I first started my practice. There was no one else out there, yet alone just orthopedist. I was the very first Korean American orthopedist in that area.
I see.
So I opened up an office in Flushing, and then I targeted the Korean population. I went to all their associations and things like that.
Gotcha.
It took a while though
To establish,
Yeah, because when you first couple of years, the intern, they're not going to send you patients that are operative. They're like,